Next, we have Dr. Jeevani Dahanayake, Senior Lecturer of Dravya Guna at IIM. She holds the important positions of Member Ayurveda Formulary Committee and the Secretary Curriculum Development. She would share her findings on advantage rasauddhis in the respiratory practice.
Hi, Bon, and good afternoon to all of you. Today I am going to present about some rasauddhis especially act on respiratory system. These are the contents of my presentation, and as we all know, we use three types of raw materials for our drug preparation, especially in Ayurveda system of medicine and in our Sri Lankan traditional system of medicine. That is plant materials, animal sources, and the metals and minerals. We here in Sri Lanka commonly use plant-based medicine, but we have also herbo-mineral preparations and the pure metallic and or mineral formulated drugs. These drugs comes under the rasauddhis, and it is described separately under the Rasashastra. So, Rasashastra is a branch of Ayurveda pharmaceutics dealing with the formulations involving drugs of metals and mineral origin. And the various aspects covered under this branch, that means the origin of that metals and minerals and their properties, their organoleptic characters, and the therapeutic properties as well. And literature related to Rasashastra reported that ancient rasaacharyas have recognized doshas of these raw materials which are obtained from the earth, and so they introduce special techniques and procedures to remove these doshas like shodhana, shamana, jarana, amrutikarana, like that. After doing these procedures, we can prescribe these materials to patients. So briefly, we can outline the advantage of rasa medicines like this. It has multidimensional action. It prevent our body from the diseases because it helps to boost our immunity system, and it's also used to cure diseases, and it has rejuvenation action. And there are two other special characteristics of rasauddhis, that is fast action, and it is effective in smaller doses. So we can consider superiority this medicine than the other medicaments in some disease conditions. But there are problems in rasa medicines. One is the duration of the drug preparation is much long. All rasa materials have a purification procedure before being administered to the body. That's why I think it takes long time to prepare drug. And the rasa medicines which do not prepare according to the standard methods, it will be toxic to the patient. And lack of clinical research finding regarding these rasauddhis rather than the herbal materials, so it is a problem in present situation, and the global non-availability. So my presentation is based on the rasauddhis mainly act on respiratory system. When we talk about the respiratory disorder, so Pranavaha, Strotas, Vikara, it is the third common cause for many deaths in the world. So we can see, according to this graph, the tuberculosis, asthma, and COPD, and the pneumonia are the common respiratory diseases. Then Samprapti of Pranavaha Srotas Vikara, we can summarize like this. After Nidana Sevana, Dosha Prakopa and the Agnimandya, and it caused to formation of armor, then Kapha Dosha and Rasa Dhatu combine with armor and enters into the Rasavaha Srotas, then settle in the Kapasthana and obstruct the Pranavaha Srotas. Therefore, in the treatment, we have to overcome these conditions. So we have to use specially Strotas-shodhana aushadha and Kapavata shamana aushadha. Therefore, we have to use Katutikta Rashaya taste and Deepana Pachana Chedana and Kapavata Shamaka drugs. So again back to the Rasa Aushadha. Here I discuss commonly used Rasa Aushadhi for respiratory tract diseases. When we talk about the rasa preparations, we can divide it into 4 major groups: Kalviya rasa preparations, Parpati preparations, Kupipakwa, and Potali preparations. Under these 4 headings, we will describe some commonly used medicines. Before that, this is a very important mixture we use in Rasa Aushadha preparations. It is known as Kajali. As we all know, it is the combination of 2 Rasa Aushadha, Parada and Gandhaka. We take equal quantities and mixed until it attains the required conditions. We want to get homogeneous mixture. There are 2 parameters to detect if whether the Kajali is prepared or not. That is Kajalaba and Nischandrata. It is blackish appearance and loss of luster. That is Kajali. We use this mixture for various Rasa Aushadha Herbo-mineral preparations. First, Kalviya preparations. This is, I think, among other 3 methods, this is the easiest method of preparation of Herbo-mineral preparations, so Rasa Aushadhi. First, we can talk about the Shwasakutara Rasa. It is very commonly used in our country. When referring literature, we can find these names for Shwasakutara Rasa. Shwasakutara Rasa, Prathama Shwasakutara Rasa, Dvitiya Shwasakutara Rasa, Maha Shwasakutara Rasa and Shwasari Rasa. But when we analyze the formulations, ingredients are same in all these formulations. The difference is the ratio of the drugs. Here I summarize some recipes according to the authentic text. First one mentioned as RSS Rasendra Sara Sangraha. It contains 3 recipes, Prathama, Dvitiya and Tritiya Shwasakutara Rasa. The difference is it contains herbals as well as Shuddha Parada, Gandhaka and Vishavatsana. The difference is the Shunti, Pippili and Maricha, that is Trikatu. The ratio of Trikatu is different from each formulations. That is the difference among these different names. And I found one research done on this Shwasakutara Rasa. They compare Shwasakutara Rasa prepared according to the equal amounts and Shwasakutara Rasa prepared according to the 8 parts of Maricha. And they did analysis, some physicochemical, phytochemical analysis, and mentioned the piperine content is high in the 8 part of Maricha containing formulation. It is obvious, we know the piperine is an active ingredient of Maricha, so the amount is high, the piperine content is also high. So they conclude that formulation is more effective than that other equal amount formulation. The indications of Shwasakutara Rasa, Shwasakasa, Asatmaja Roga, Rajyakshma are like that, and Anupana is commonly we use Anupana is Ardhaka Sarasa. Other one is the Kapaketu Rasa. It contains Shankabhashma, Shodhita Tankana, Shodhita Vachanavi and Pippali and Ardhaka Sarasa. All these ingredients have Katu Rasa, Katu Vipaka and Ushna Virya. So it helps to pacify Vata and Kapha dosha, and also it has Strotas-shodhana action. Indications of Kapaketu Rasa can be mentioned like this: Pinasa, Kasa, Shwasa, Galaroga, Galagraha, like that. And they mention different dosages according to the diseases. Kasaroga for 2 Raktika, Jwara for 1 to 2 Raktika, like that they mention different doses. And Swasakasa Chintamani Rasa, very effective drug in Pranavaha Roga. It is also herbo-mineral preparation, and the ratios is like this. And they metals and minerals, they use 4 types of liquid medias to grind those materials and metals to prepare this formulation. That is Kantakari Swarasa, Ajadugda, Madhuyashti decoction and Nagavalli Swarasa, grinding for 7 days. Then the potency of those liquid solutions will also get that metals and minerals. It balances Vata and Kapha dosha. So we can use Shwasakasa, Pratishya, Pinasa, Rajayakshma and like this. The common Anupana is Madhu, but we can use according to the doshic condition and the prakriti of the patient, we can change the Anupana. Then the second preparation, that is about the Kalviya preparation. The second preparation is the Parpati. This is also a special kind of preparation. Mainly this is mentioned for the Grahani Roga, Rasa Parpati. This name is derived from the method by which flakes of the compound are obtained. I saw there's a picture also here, preparation of Rasa Parpati. Rasa Parpati contain equal amount of purified mercury and sulfur, that is Shodhita Parada and Gandhaka. It balances 3 dosha. Another variety of Parpati, Swarna Parpati, it contain Parada, Gandhaka and Shodhita Swarna. It is a very good remedy for or medicine for Rajayakshma, and it also has Vajikarana effect. Anupana is milk, honey, or as per the disease condition. It balances 3 dosha, that is Vata, Pitta and Kapha. And the third preparation method is Kupipakwa preparation. This is also known as Kupipakwa Rasayana. Kupi is it's a kind of instrument made by using a glass bottle and covered by 7 layers of rag and mud, and we put our prepared medicine, the raw materials, into this bottle and heat in the Valuka yantra. This the temperature of using in this preparation is very specific. We use Mrudu Agni, Madhya Agni and Tikshna Agni, like that temperature variation is occurs. And according to the preparation method and the ingredients, we have varieties of Kupipakwa preparations. According to the ingredients, Sagandha and Nirgandha, and according to the manufacturing method, Antarduma and Bahirduma, and depositing place of the drug, that finished product deposition place, it divided into Kantastha, Talastha and Ubhayastha. It means the preparation, when we when we give heat to that Kupi yantra, preparation made, final product will be deposited in the bottom of the bottle or around the neck or both places. That's why we call Kantastha, Talastha or Ubhayastha. These Kupipakwa preparations have Rasayana action, so also they named as Kupipakwa Rasayana. The importance of Kupipakwa Rasayana, it has Lagu Guna due to very high degree temperature, so it enabling the drug to penetrate faster and deeper into the tissues. Also, it helps to enhance the Dhattvagni and Chaturagni. And in Kupipakwa method, the potency and efficacy of mercury increases in proportion to the amount of sulfur burnt in the jarana process. This is one example of Kupipakwa Rasayana. It is Rasa Sindhoora. The ingredients, Shodhita Parada and Shodhita Gandhaka. That is, first we make kajjali from using these 2 drugs, raw materials, and give bhavana from Vatankura Swarasa, that is extracted juice of Ficus bengalensis. It also balances 3 dosha. Then these are the actions of Rasa Sindhoora, Kapha Shamana, Kapha Nissaraka, Pupusa Balya, Strotas-shodhana and Yoga Vahi. We use Vasa Swarasa, Pippali and Madhu as Anupana. Samira Pannanga Rasa is also a Kupipakwa preparation used for the respiratory diseases. Parada Gandhaka, Shodhita Haritala, Manashila, and the grinding agent is Tulasi Patra Swarasa. Equal amounts used for these preparations. It has Kapavata Shamaka and Dushta Kapha Sravi action. These are the indications of Samira Pannanga Rasa. It used extensively to open up the blocked channels, as in cause of asthma, bronchitis, diseases. Swarnavanga, another Kupipakwa preparation. Here, Vanga Bhashma we use. Bhashma we use as a raw material as well as the single drug for the diseases. The grinding Swarasa is Nimbu Swarasa. It also balances 3 dosha. These are the indication of Swarnavanga, chronic cough, bronchitis, asthma and diabetes. Here you can see the picture of Swarnavanga. Rasa Sindhoora, Samira Pannanga Rasa are in Sindhoora color, that brick red color. But here we can see the golden color, and it is the Thalastha preparation. It deposits in the bottom of the bottle. Potali Rasayana is the 4th preparation among the 4 rasa preparations. This is a very special method of preparation. The drug which is prepared by giving compactness to the scattered materials by special method of preparation is termed as potali. The dosage form is, it is very hard and solid. The shape of the preparation is shikarakara or pugapalakara, that is cone shape having the flat bottom and tapering towards. The administration by rubbing it on a hard surface or stone applied with 1 to 2 drops of grutha or honey. This Hemagarbha Potali Rasa, it is the indication for the Kapavata diseases. It includes Parada and Gandhaka, also Swarna Bhashma and Tamra Bhashma, and titurate with Kumarika Swarasa for 7 days. Then we can prepare that Hemagarbha Potali Rasa. It can give chronic conditions of the respiratory system, and it is advised to take curd and rice while taking this medicine. This is some pictures I got from the web. Here first picture shows the grinding the materials with the Kumari Patra Swarasa and made that cone shape solid matter, and then it is covered by a silk cloth and immersed in a liquid Gandhaka and give some heat. After that we obtain, this last picture shows that hard solid dosage form. And Abra Bhashma, it is commonly used Bhashma in Rasashastra. As I mentioned earlier, it is a raw material. We can use it as a raw material as well as the single drug for the diseases. The Bhashma color is brick red color after the long process. These are the indications of Abra Bhashma, diseases due to Kapha dosha and digestive impairment, bleeding disorders, urinary tract disorders, diabetes, like that. And we also have in our Sri Lankan traditional system of medicine that type of herbo-mineral preparations. They are mentioned in our ancient books. Especially commonly we use Sita Ramavati, Buddharaja Gulya, Buddharaja Kalkaya, and many other drugs we had used earlier, but now it is limited to some few drugs. These are all herbo-mineral preparations and used with various anupana to many diseases. not only the respiratory diseases. We can change the anupana. They mention in poetry form and in literature, they mention different anupana for different diseases. And I want to talk about the drug standardization also, because it is a very common two words in today's world, because the global demand is increased for herbal remedies. Also, they demand for quality assured standard products. So we have to prepare our drugs according to the standard methods. WHO mentioned several standard procedures for drug standardization, but I want to say in our authentic text, we also have standardization methods. Burhatraya specially described about the Aushadha Sangrahana Kala, basic principles of Baisajya Kalpana, like that. So we have to combine our standards procedures with these WHO procedures to product quality and efficacy drug. So we can follow these standardization procedures: organoleptic and physicochemical test, qualitative and quantitative chemical test, and instrumental examination. These are some types of instruments that we can use, especially for the Rasa Aushadha, to detect finished products. Here I mentioned some examples. This is a transmission electron microscopy image of the Shwasakutara Rasa final product, and the graphs shows the chemical compounds of the Shwasakutara Rasa. And this is the scanned electron microscope image of the Kajjali. And these two graphs shows the chemical patterns of the Kajjali, and the second one shows the chemical patterns of the Shwasakutara Rasa. According to the peaks, we can identify the chemicals or the free metals or something. If there are anything, we can identify. And this is the transmission electron microscopy image of the Rasa Sindhoora. And we can find some experimental studies related to these Rasa Aushadhi. This is antihistaminic activity of Kapaketu Rasa. It shows 2 dosage give better action in day 5. And the Shwasakutara Rasa has antimicrobial action, and hepatoprotective action shows Abraka Bhashma. And Swarnavanga researchers did short duration toxicity study. They conclude it is safe drug. And Samira Pannanga Rasa for the asthma patients, it also effective. And Swasakasa Chintamani Rasa for Tamaka Shwasa, they show it also effective. So we can summarize these things. The Rasa Aushadhi can be used to treat Pranavaha Strotas diseases effectively and restoring the functional capacity of Pranavaha Strotas. And the pharmaceutical standardization of medicine is an essential requirement in modern society. So we have to do it to establish the safety and efficacy of the drugs. Thank you.
Thank you very much, Dr. Jeevani Dahanayake. Would like to request Dr. Jeevani Dahanayake to remain on the main platform. As we are ready to present you also with a special token of appreciation, would like to call upon Dr. Mrs. S.K.M.K. Herapabdeniya to join with us to present Dr. Jeevani Dahanayake with this special token of appreciation. Thank you very much. So we're going to move on, ladies and gentlemen.